Hi, my name is Dr. Lauren Merz. I'm an assistant professor of medicine at the University of Michigan. Today we're going to be talking about how genetic variants, especially those that you see in different patient populations, might impact the kind of treatment that you receive for multiple myeloma and what those outcomes look like. I really focus on something called the Duffy antigen. This is something that you find on your red blood cells, and the lack of that protein is more common in people who have genetic ancestry from sub-Saharan Africa and the Arabian Peninsula. This is actually a really advantageous mutation where you were protected against malaria. However, we also know that it impacts neutrophils. Neutrophils are a type of white blood cell that are really important in fighting infection. It does not impact your neutrophil function or ability to fight infection, but rather the Duffy Null phenotype impacts where neutrophils live. More tend to go to the spleen rather than hang out in the blood where we can test it in our blood draws. We're also learning that this might impact the way that your body responds to different cancer therapies and might help us select or personalize what treatments that we want to look at. One of the recent studies we did is an analysis of determination. This was a clinical trial for multiple myeloma where we compared people who got medication only, or RVD, compared to people who got RVD, which is the medications, plus a transplant. Overall in the trial, we found that people had a longer progression-free survival when they got the transplant. We then looked at it by race, and we saw that people who self-identified as Black or African American no longer had a benefit for getting a transplant. It was totally equal between the medications and the transplant. Race is a social construct. It does not dictate biology or things that we see within the body. So instead, we looked at this genetic variant of Duffy. When we looked at this, we found that there was a longer progression-free survival for the medications rather than the transplant, which suggests that we might be able to defer transplant for people who have the Duffy Null phenotype. Now, this is just the very beginning of this work. We still need to understand why we're seeing these differences. Is it something about the neutrophils and the way that we're giving the medications? Is it something about the way that the body is responding to the therapies and responding to the outcomes? So more work yet to be done, but we really want to focus on making sure that we personalize and select therapy for each individual, and this is one of the ways that we're working on that. The Duffy Null phenotype is really easy to test. It's the same as if you get a type in screen or a blood draw, the same way that you would know if you are AB positive or O negative or any other one of those blood types. It's the same way that we test. So it's very simple to obtain your Duffy status, and it's very cheap. And because it's something that's so simple and so cheap and so easy, we really want to make sure we understand this for all the patients that we serve.
If our videos have helped you in any way, and you're able to, please consider making a donation to help us continue this important work.
Your gift will go 3 times as far when we reach $500,000 by the end of the year.
Every contribution, big or small, makes a difference, and we're deeply grateful for your support.